Let's debunk the Tylenol autism myth. I'm Dr. Nancy Silva, board-certified pediatrician and mom in Wesley Chapel, Florida. This week, undoubtedly, you heard that Tylenol causes autism. It does not cause autism. If you had Tylenol while you were pregnant, you did not give your baby autism. Where did this come from? Did they just pull this out of a hat? Actually, they did not, but they failed to mention one crucial detail. Harvard actually did a study that was a review of 45 other studies. And in those studies, they were analyzing moms that took Tylenol and the outcomes of their children having autism. They found that moms who took Tylenol for 4 weeks had a correlation. Doesn't mean it's a cause, but they had more kids with autism. So this is the thing. Is that the only study out there? Heck no, that's not the only study out there. There's a bunch of them, but most recently was a study published in 2024 from Sweden, where they analyzed over 2 million of their children. And they were specifically looking at Tylenol and autism. And guess what? They found no link whatsoever. So that's it debunked. Tylenol is not a known cause. What are known causes? 80% of autism so far has been diagnosed as genetic mutations. However, it's a complex neurological condition, and it's believed that it's multifactorial, meaning some of it is probably environment, meaning some of it may be home factors, some of it is genetics. There are multiple reasons for autism, and no two are necessarily alike, and no treatment is necessarily alike for every child who has autism. It's a very broad spectrum. So why are more and more kids being diagnosed with it? Guess what? We're actually looking for it more. And that means we being the doctor and we being the parent. And that's the crucial part of this. I mentioned in a prior video, the doctor-patient relationship is key. If you are taking Tylenol while you're pregnant, you have to discuss this with your OBGYN. You just have to. There are multiple situations in which it's important to be taking Tylenol. For example, you may have a UTI and you may have developed a fever. A pregnant woman with a fever, that can cause brain damage. That can cause birth defects for your unborn baby. But again, you have to talk about it with your doctor. In that Harvard study, which was a review of 45 studies, 4 weeks of Tylenol, guess what again? That means those moms had other conditions. Or they didn't have that doctor-patient relationship and they didn't discuss it with their doctor. The other thing that's really important is that is the one safe anti-fever and pain medicine that pregnant moms can take. A pregnant mom can't take ibuprofen, most commonly known as Motrin. A pregnant mom also can't take Aleve. Why? You know what they do? They cause amniotic bands. So what's an amniotic band? What's the big deal? They basically will kind of make like a saran wrap tight, like a rubber band, so that the fluid starts getting these and it wraps around the baby. It can wrap around the baby's face, causing disfigurement. It can wrap around the baby's arm, causing a loss of an arm or a non-functioning arm, and it can go anywhere. So I don't want pregnant moms to think, okay, I can't take Tylenol, I'll take ibuprofen. I also really am upset about being told that pregnant moms just have to tough it out. I don't want another man to tell me or to tell any pregnant mom to tough it out, because they've never been pregnant and they don't know how much we have to tough it out already. There is no need to tough it out. What there is a need for is for you to talk to your doctor if you need to take Tylenol while you're pregnant or if you're thinking about it. Personally, I limited anything unnatural that I could take while I was pregnant. This is the other thing you need. Aside from a doctor-patient relationship, you need common sense. Anything you're putting into your mouth could go to your unborn baby. And that includes makeup. That includes hair dye. That includes all the foods you're eating, like tuna. So one of the recommendations is not to have more than 1 can of tuna a week while you're pregnant. You do want to have fish, that's healthy for your baby, but it's not healthy if you're taking too much because it has methyl mercury that stays for anywhere from 30 to 150 days in your body. So I didn't have tuna when I was pregnant. You're not supposed to smoke. You're not supposed to drink. You really shouldn't be having heavy amounts of caffeine. All of these things that you should not be doing. It is safe for you to take. You shouldn't have to suffer in pain. You do need to talk to your doctor. Again, in my case with my daughter, I did tough it out quite a bit because I suffered very bad migraines. And I just would even put like ice packs and ice gel packs on my head to keep it down. But it was horrific pain. But I discussed it with my doctor. And so I took it twice. There are other people who have taken Tylenol with pregnancies and nothing happened. And there are people who haven't taken Tylenol with their pregnancies and their children had autism. So talk to your doctor, have a good doctor-patient relationship, have common sense in what you're going to ingest or put on your skin or put in your hair, on or in your body. I hope this was helpful. I hope I helped debunk it so you know where it came from, where we're going to. I have some helpful guides that I've created. There is one, Fever Tips 101. You can find it on the comment below, or you can go to my website, drsilvakidsgrow.com, and you can go to the shop area. You'll see free guides and you'll see some trainings. Until the next time, be kind to yourself and bye-bye.